Hello and welcome to Mother Tongue, the podcast where modern motherhood meets real life. I'm Marianne, founder, podcast host, and mum of three, and I created this space for all the mums who are juggling it all. From toddlers and tantrums to businesses and burnout, we're talking about what it actually takes to build a life, a career, and a family all at once. Here, you'll hear honest, unfiltered conversations with founders, freelancers, experts, and everyday mums about work, wellness, identity, mental health, relationships, and everything we carry that no one talks about. Hit follow, join our community, We Are Mother Tongue, and tune in for real talk that supports the whole you, because modern motherhood is busy and no one should do it all alone.
We are so incredibly excited to welcome Dr. Dave.
I'm very good, thank you. Thank you for inviting me.
Thank you for coming and spending your morning with us. Are you supposed to be at work right now?
I'm just starting a bit late.
Okay, all right. Okay, good. I feel less bad now. Dr. Dave, before we get into all good stuff today, fevers, rashes, runny noses, can you just start by telling us a little bit about yourself?
So, yes, my name is David Cremonesini. I know you didn't want to try that, but so Consultant Paediatrician from the UK with an interest in allergy. I've been working at Mediclinic Parkview since January 2019. I did work at a medical hospital in 2014 for 2 years, and I went back to UK, but was missing Dubai, so I had to come back.
Yeah.
Very happy at Parkview. But I used to work in the UK, trained in Oxford and London, and did a degree in allergies. So I feel that there's not many paediatricians with allergy interest, but of course everyone's got an allergy these days, so it's quite a good mix. With my allergy clinic, we do allergy testing, skin prick testing. One thing parents worry about is trying foods, and we do it in the clinic while they're just sitting there. So to give them that confidence, because with food allergies, the key thing is, first of all, you can't diagnose it until you've tried it.
Yeah.
And people are worried about trying it. Let's get it in. The earlier you get it, the better. So, but a lot of my time is also general pediatrics, and what we're going to talk about today. You say I'm not at work, but I would be having this discussion this morning.
Some parent, exactly. Now, you've mentioned that obviously you've done lots of work in the UK before. I'm going to start with a question on lifestyle and living in Dubai, because I mean, if you're on British Mums or any of these Facebook groups,
I'm not, by the way.
You're not a British mum, so that is probably a good thing. But lots of people worry about the climate here, especially when we get into summer. It gets very dusty. They say the pollution levels are very high, and then kids are sick more often. They're getting more of these runny noses. They're getting more fevers. Viruses are spreading around more. Is that something that's true, or is, toddlerhood kids just passing around things left, right, and centre, regardless of the country you're in?
I think, parents notice a difference when they come to Dubai from maybe if they come from the UK. Of course, we know what the environment's like. We know about the pollution, and that will be having an impact, particularly on children if they already have some breathing issues. I don't see how it would make an impact on catching a virus, but if you have a virus and a sensitive chest, maybe, then that pollution won't help. But it's the country we live in. There's not much we can do about it.
No.
But I guess the key thing is, if we're worried about that, is get the right help. If your child's got asthma, pollution won't help. Let's make sure you get the right treatment. We can control that asthma. Often parents think about asthma, well, it's one of those things. He's not doing much sport. That's asthma. Not at all. Proper treatment. People should be living a normal life, even with the pollution. So although there's pollution there, we don't want to make excuses if your child is unwell or suffering, and make sure you get the right help.
Okay, good to know. I want to start with fevers today, because I feel like there is a lot of mixed messaging on fevers, a lot of mixed messaging on what to do when your kid has a fever, and also how to treat a fever based on the age of your child. So let's start with babies, for example. Baby gets a fever. At what point do we worry about a fever within a baby?
Well, with the baby, certainly the younger the baby, we need to be a bit more careful. Mm-hmm. So young babies, especially under 3 months, they are at the most vulnerable. Their immune system is still developing. They've not had any vaccines. There's a risk that they may catch an infection from the delivery, etc., in the very early phase. So we have to be extra careful. And also, of course, young babies, it's very hard to know what's going on. A sleeping baby might be the only sign of an infection. And they don't always have such a high fever. So we have to be more careful, making sure that if the baby's under 3 months, I would just see a doctor. If you're worried about fever, get checked out, absolutely. Of course, babies get viruses like everybody else. It doesn't mean anything serious, but get checked out. But I would be worried, particularly if the baby's got a routine, the baby has a fever, that routine has changed. The baby is sleeping more, missing feeds, maybe more lethargic. You noticed a change, get checked out. And it's more likely in a baby we may do blood tests, investigations. We may even need to do a lumbar puncture to rule out meningitis. That's the most likely time they catch it. Still quite rare, but most likely time. And of course, a baby can't tell you whether they have a headache. It hurts to look at the light. So we may need to do some tests. And if you're the mother of that baby, don't be too worried. Trust the doctors. Hopefully they're doing a good job. And let's rule more severe infections out. And by doing that, then we can be more reassured.
I mean, we've had a few early incidences. My little girl, she got RSV at 5 weeks. That was a fun one because RSV in babies especially is brutal because you can't really do a great deal about it. And then I thought, you know, we've had like the emergencies with young kids. I'm not going to get anything worse than that. 2 weeks with this baby. 2 weeks for an A&E for the night. That was fun.
Yeah.
With a fever. And I really panicked because the guidelines were so mixed on, you know, what was considered a high fever in a baby. Because let's say my 4-year-old has a fever of 39. I know that I'm not going to massively worry. If it went above 40, I might be a little bit more concerned. But that's very different in a baby. So if the baby has a temperature of 38, should we be going to A&E? Or if it gets to 38.5, for example, at what point is it classed as an emergency?
So this is a question that comes up all the time. And I've hopefully nailed my pattern well.
Hopefully.
Now, the end of the day, the fever is the body fighting the infection.
Yes.
Fever is actually a good thing in one sense. It helps the body fight the infection. All mothers want their child to fight the infection. Now, there isn't a number that's dangerous, particularly, or a number that means you have to come to hospital.
Okay.
39, 40, the fever will never go too high. Not possible. People read about this online, but no one knows any child where the fever went too high.
Okay, that's good to know.
No one knows anybody. So now it may go high. And absolutely, if it goes high, you give medicine because a high fever will make the child miserable and unhappy. And then you assess the response with the medicine.
Yeah.
You're looking for the child picking up, being able to drink, interact appropriately, some activity, probably won't eat. Parents worry when the child's not eating, but we don't eat when we have a fever. Why should children be different? But drinking's important. So really, if the fever goes high to 40, absolutely assess your child, think about what you want to do, give medicine, and then think, how was my child an hour before the temperature was 40? If he or she was running around, drinking, playing, after the medicine, do they go back to how they were? If they do, that's reassuring. I'm not saying you shouldn't go to hospital, and as parents, you have to make a judgment. Parents message me a lot about fever. What should I do? How can I know for sure on a message? You have to make a judgment. But it is about not so much the number, it's more about how the child is other than the fever.
Okay.
So with a baby, again, if it's a young baby, whether it's 38 or 38.5, get checked out.
Okay.
Because it's a baby. Yeah. But if it's a bit older baby where we're more confident about, and after the fever comes down, the child is behaving normally, then that's reassuring, but you still make a judgment. And I'd never tell any parent off for coming to see a doctor.
Yeah.
But of course, whether you need to rush immediately or not, or worry too much, take the child as a whole rather than just focusing on the number. And another thing is parents worry after medicine that the fever's still high. Of course it will be. When we're giving medicine, we're going against the body. The body is creating that fever. We give medicine. The body says, hey, what are you doing? Leave me alone. I'm trying to help here. So it will go back up a bit, or it may stay a bit high. But as long as the medicine makes the child feel better, that they can drink, interact, and you can see that your child feels better and be reassured a bit more, that's the key thing.
So I have heard that some people don't ever give medication, I mean, I'm talking in older children, I'm not talking in babies, when they have a fever. So the body is learning how to cope and how to essentially warn off these viruses or whatever is entering the body. What are your thoughts on that? Do you think we should always give medication, or are there times that the fever's not too high, maybe just see if the...
Well, I mean, I think parents give medication early, worried it will go too high. But it won't go too high, but it may go higher. But the main point for giving medication is not because of a number. It's because whatever the number is impacting on the baby or the child to be miserable, unhappy, in pain. We are alleviating distress with the medication, not a number. So in theory, if a child's got a fever of 39, older child, they're running around happy, maybe you don't need to give medicine. But it's a judgment that you make as a parent. But it's not that you have to give it or necessarily worry it will go too high, because it won't. One thing parents worry about, of course, are seizures.
Yes.
Yes. Now, they normally resolve by the age of 5. So if your child's over 6, then very, very unlikely they're going to get a seizure. And if they do get a seizure, then we might think of something else rather than a febrile seizure. But actually, when children get seizures with a fever, it's not so much because the fever is high and sitting high for a while. It happens early on in the illness as the fever goes up. And there's a change in the brain with the fever changing. And suddenly, oh God, my child's having a seizure. I didn't even know he had a fever, because it normally happens early on. And we know that if a child has a seizure, they are at risk of having another one, but they're very hard to prevent because they happen early on in the illness when you don't realize. So I think if you have a child with febrile seizures, give medicine by all means, and give it early as a precaution if you want. But don't feel you made a mistake if they still get one, because it's not easy to necessarily prevent. But then the vast majority of children who have a seizure, if it's fairly short, no major issues after it, there's no consequences at all. And over 90% of these children don't go on to have epilepsy. So it's nothing too worrying to maybe have them. But of course, as a parent, seeing your child having a seizure is very scary.
Wow, traumatic. And I mean, in the case of the seizure, should we go to the hospital afterwards?
Well, so, I mean, if you're a family you're happy that the child got a virus, your child's had many seizures in the past, you're confident you know what this is, you may not necessarily have to, I think the first time, go to hospital. If the seizures stop, get checked out, it will be scary for you, absolutely. Second or third time, you make a judgment. You know, it's very hard to sort of say for definite what parents will want to do, but again, in theory, if a child had a little seizure, you've had it before, the fever goes down, they're running around playing again afterwards. Maybe you don't need to
worry. Okay, that's good to know. And in terms of the medication that we offer, obviously the most common that are available on the market, paracetamol, Nurofen. Now, in my experience, Nurofen always works better with fevers in our household. But I know that Nurofen is quite a lot stronger than paracetamol, and especially in younger children and babies, Calpol or paracetamol is considered safer. Is that true?
Yes. I mean, I think some children respond better to Nurofen, some children respond better to paracetamol. I think, of course, if we're saying it's working because the fever's normal, but it's not working if it's not, of course, it may not be normal. And if you give them paracetamol and the child feels better and they're drinking, then it's working. I think I don't get too, I think often parents have a preference, give one and see. It's important to have a backup. When you give paracetamol or Nurofen, you can't then give it again for 6 hours. So, but what about if the child has a fever again before the 6 hours is up, or is in pain, or is miserable? You have the other ones. So you have both as a bit available to you. Of course, you know, if after 5 hours the fever goes up a bit, but the child is still running around playing, you maybe don't need to give medicine at that point anyway. But having 2 options obviously makes your life a difference.
And is there any worry about, you know, children getting very hot when sleeping? So maybe they spike a fever in the middle of the night. Should we ever be worried about that? Because, I mean, me being the anxious parent that I am, if I had a child who had a fever when they went to bed, I would probably go and check them all the time.
Now, perfectly reasonable if your child's unwell to go and check. I think parents notice that the fever goes higher at night, but that's probably because you're not checking them as closely as you are during the day. You're not seeing a deterioration, so you will get a chance to go a bit higher. Now, you go and check on your child, they're asleep, they've got a fever. What do you do? I would make a judgment. If the child is asleep, the colour's good, breathing's okay, you feel the child is fine, I wouldn't necessarily wake the child up, because in order to fight an infection and help your immune system, you need rest, you need sleep. You wake a child up, they're not going to be very happy. If they wake up and they're hot, then that's different.
Yeah.
However, if you sit there, they're hot, you're worried, and you think, but Dr. Davis said don't wake them up. No, if you're worried, wake them up. Yeah. You've got to do what you feel is right, but you wouldn't necessarily have to wake them up, because again, the fever never goes too high.
Yeah. Okay, that is good to know. Let's say we have a kid who's had a fever for 5 days, a relatively high fever for 5 days. Is there a period of time that a kid has a fever that is considered not normal?
So, I mean, again, it's more about how the child is. Now, 5 days, there are viral infections that will cause fever for 5 days, 7 days. I think if you've not had your child checked out and it's been 5 days,
Go ahead and get checked.
Now, you know, most infections are viruses, don't need antibiotics, but children may get secondary bacterial infections that perhaps need it. And if the fever's persisting, that may be a sign of that. But I guess if the fever's 5 days, but there's no other change in the child apart from just fever, as in when the fever's down, the child continues to be drinking, playing, breathing okay, so you've managed to watch the child a few days and you still not see the deterioration, but the fever's still there, that's reassuring. But get checked out, but not necessarily a worrying feature if it's been 5 days. It doesn't mean, oh, I need to now do a blood test or things like that, you know. I'm not a big fan of blood tests because, first of all, children don't like it.
Dramatic, no.
The question for me when we do a blood test is it going to change what I'm going to do?
Yeah.
What the biggest factor that tells us what to do is seeing the child, examining the child, hearing about what the child is doing. But there is no test that will tell us, at least there's no blood test that will tell us whether it's a bacterial infection or not. Swabs in the nose and the throat, no harm in doing that. And the negative test for bacteria is reassuring. But again, it's that general trend. And if we always say when the child leaves the clinic, let's see probably a virus. I don't know for sure. Let's not give antibiotics. But if the child is deteriorating with drinking, breathing activity, then you come back. Absolutely.
Yeah.
You must come back.
I'm going to move on to rashes now. Now, we've been lucky, touch wood. We haven't experienced loads of rashes. Lots of runny nose, fevers, coughs, but rashes is something that I actually don't know a lot about. How do we... Well, exactly. But it's always good to be prepared for these things, Dr. David. How would you distinguish between a rash that is considered a bad rash versus a rash that's maybe just a bit of eczema?
Yeah, I mean, look, I mean, as children... So children get rashes a hell of a lot.
Yeah.
And, you know, I mean, it could be a number of things. And again, you know, it's back to how is the child other than the rash? If the child, apart from the rash, is perfectly fine, that's reassuring.
Okay.
But if the parents, I think, will come if they have a rash, they want to know what it is, they're not sure. And sometimes we don't necessarily know, but if the child is otherwise normal, that's a good sign. But clues, you know, obviously, you know, common cause of a rash is a recent virus. Now, so some children don't always get a fever with a virus, but they often may have had one and then a rash appears. Allergy rash, urticaria, hives, which is itchy, is often not caused by allergy, and viruses can cause that rash. And parents may come with that, and then we take a history. But what's going on? You know, if the rash is lasting 3-4 days, not getting any worse, not getting any better, but the child is remaining otherwise normal, that's reassuring. And certainly hives and allergy rash, if it's lasted more than 2 days, then it's almost always not allergy. And the treatment is just antihistamine. You know, if the rash is a problem for the child, itchy, dry, then use your creams, use antihistamine and manage the rash. But, I mean, many causes for rashes get checked out, but certainly if the child's perfectly normal, that's reassuring.
Okay. What about meningitis? Because I remember, especially when I was growing up, meningitis was something the parents were quite worried about. And I think it's still something that parents get concerned about today. And I remember people used to rub a glass over your arm if you had a rash to do the rash test. Now, I actually don't know what you're looking for when you do the glass thing over over the arm.
Sure.
Is that still a thing for meningitis?
So if you've got a bacteria that causes meningitis in the blood, that you also have septicemia, then you may get this rash whereby the capillaries cause little bleeding under the skin, and when you rub it, the rash doesn't go away because it's almost a bit like a bruise, or there's blood in the skin that stays there.
Okay.
So now there are other causes for that rash. If you've got that rash, so the glass test, it doesn't go away with the glass test. If you've got that rash in a child who has got a fever or is unwell, it doesn't mean they have meningitis, but get checked.
Yeah.
Absolutely. So I think it's useful in that sense. Just let the doctor make a decision, maybe do some tests. If you've got that rash, I mean, of course, if you go over a bruise and it won't move away. So if you've got that rash and the child's perfectly normal, that's reassuring. Look, I mean, I think if you see that rash and you're worried, get checked out, because, it's potentially missing something is devastating, but it's a rare thing, but we don't want to miss it. So I think, play safe with that rash, absolutely.
Okay. I mean, I said that I hadn't had much experience with rashes, but my smallest his is more like very dry skin, actually more eczema, and he had terrible cradle cap, which was down to a camel protein allergy. Are there other allergies in babies that presents with rashes and dry skin and all that kind of stuff, or is it mostly CMPA?
Now, I don't know your child. Mm-hmm. I've never met your child.
You have not.
So, but I wonder whether that's really true, because, well, first of all, eczema, so parents worry about food triggering eczema, and it doesn't.
Okay.
Eczema is a skin problem. It's not a food problem. Okay. Now, never say never. I'm not saying food never triggers, but it's not the main thing. Most common scenario when parents come to me with eczema and itchy rash and they're worried about the food, I will talk about, hang on a minute, how are you managing this eczema?
Yeah.
It's dry skin. There's no cure. You have to manage it with regular moisturizers, 3-4 times a day, and you have to use steroids, maybe for a little bit if the child is itchy or red, or at least that's the first thing you try. And there's another steroid phobia out there. Yeah. So parents don't use steroids, and then the child is remaining itchy and red, and then they start thinking it's a food. Yeah. Of course, milk may get the blame because the child has milk every day, but it doesn't mean the milk's causing the rash. So, and the testing for that is not very accurate either. So I think the key thing with eczema, particularly allergy rashes or etc., is the right treatment, and then we see. So a difficult one, but I think, a lot of my time is discussing how safe these creams are. Steroids are fine, If you don't want to use it, as a parent, you have to make a decision. Do you want to trust the eczema specialists in the UK and the US who've written guidelines and said they are safe, or do you want to trust someone else? And you have to make a decision. I would trust the specialists. If you don't want to do that, then that's your call.
No, I agree with you on that. It's a funny one, especially in babies, because again, I mean, look, we had a CMPA baby in the past. I knew this one probably might have it when everything started coming out. And I mean, there were lots of the signs and symptoms, and it did help. But again, it's always an age thing as well. Sometimes babies get things that they grow out of when they get a bit bigger, or their insides regulate, or they start weaning, all these things. But there's a never-ending puzzle that I still haven't figured out.
No, cow's milk can be, I think, particularly in formula-fed babies. Yeah. Breastfed babies, very unlikely. Yeah. And too often parents are told to avoid dairy, but the amount of dairy in breast milk is so small. Yeah. And the problem with a mother avoiding dairy is that then they're more likely to stop breastfeeding. That's the last thing.
Agree. Runny noses and coughs. Love this. So we are a coughing family.
Of course, 3 children you have, don't you? So one gets it, they all get it.
Yeah, my daughter especially. I mean, she probably coughs 10 months out of 12. She likes to cough. And what was particularly fun is when she was probably until the age of 1, she would cough and vomit. She would cough a few times and there would be projectile vomit everywhere. It was a great time of life. I changed a lot of sheets. She never seemed that fussed by it, but yeah, we're very well versed with coughs, and runny noses. I mean, I feel like kids have runny noses all year round, which is only heightened when they start nursery. How concerned should we be about a snotty nose? I mean, I'm not that concerned anymore, but when is it that?
Well, so I guess so. Children get coughs and colds all the time. Snotty nose, it's normal. If you get a cold, it may take 2 or 3 weeks. What's the treatment? There's no medicine really that will reduce it. Just use saline. Parents use, and snot.
What do you think about the snot?
Yeah, absolutely. So just remove it if you can. It will come back. But if the blockage is causing a problem for the child, particularly a baby, to feed or sleep, then try and remove it. Give them a bit of respite a little bit. I see children my parents are using steam. Never use steam. Just use a spray in the nose to clear it. Saline spray, hot water. We had a child that was given steam over that hot bowl of water. The water fell on the child's lap. Oh my God. Had a huge burn. Why put your child at risk like that? You don't need anything hot. Just going in there. Now, and of course, if a child has a snotty nose, they are going to cough. There's nothing we can do about that. But I think I see parents all the time and they worry about cough, and they tell me my child's coughing, and I say, good. Coughing is the body's way of clearing mucus. Parents worry about pneumonia with a cough, but pneumonia is not just a cough. It's breathlessness, fever, lethargy. The most important thing a child does to prevent themselves from getting pneumonia is coughing. So the treatment for coughing doesn't work. Cough medicines don't work. I never give them. And of course, parents are often prescribed them, sadly. And then when they find that they don't work, they get more worried, but they were never going to work. And again, with cough and cold like fever, the key thing is more, how is the child otherwise? When to be worried is more if the child is having high fevers, lethargic, not drinking, breathless. Coughing and runny nose does not necessarily go on the chest necessarily, but if it does, you will see a deterioration in your child. But if they're active, otherwise fine, which often they are, then that's reassuring. And at night time, they cough more because they're lying down. The mucus is in their throat. But again, that's good. We want them to cough. If there's mucus there, it protects their lungs, which we all want.
So I'm going to move on to croup and RSV and all these other things that happen when we have small humans at home. But I wanted to talk about the mucus because this is normally my concern, especially if it's here. I always worry that it's going to hit their chest. Is there any way of preventing it hitting their chest?
They're not doing that themselves by coughing.
Okay, so we can't do anything else.
Not a huge amount.
Yeah.
And, now there are children who can't cough because they have some underlying neurological problem, etc. But you could clear the nose. You can use saline. You can give them a good wash. So the more you clear, that's less to go back. Yeah. But there's no real medicine to thicken and things like that. No. Now, everyone's got nebulizers in this part.
Yeah, I was going to say thoughts and nebulizers.
Yeah, in UK, no one's got nebulizers. No. And yet we've all got the same coughs and colds. Yeah. So Ventolin, so I see doctors who prescribe Ventolin and say, take it for a week. What's this, take it for a week? How do you know they need it for a week? Ventolin is more for breathing. Yes. It doesn't help the nose. No. So if their breathing is fine and it's congestion, nose, you could try a saline.
I was about to say.
No harm in it if you have a nebulizer. Okay, yeah. There's no harm in it, But there's no magic. It's time. And we give it time. But while we're waiting, making sure that the child continues to be active, breathing okay, fever settles, drinking, etc. I'm not saying don't be worried ever, but be reassured if the child is otherwise okay.
What about things like humidifiers with Olbasoil or the Calpol plugins?
You know what? You can try them if you want.
But medically proven?
Not really, no.
Okay.
They may help, but I don't encourage them because I don't want parents to come back and say, Doctor, we spent all this money, it's not helping. Yeah. And of course, if it helps a bit, a few weeks later, they get another cough attack.
Oh, for sure. Yeah.
Yeah. Now, one thing parents worry about is allergy causing the runny nose.
Yeah.
I think the clues that it's not allergy, so certainly if it comes and goes. Yeah. So they last a few weeks, and then goes away for a few weeks. Yeah. And then back again. That sounds more likely a virus because if it was allergy, it should be happening every day. Yeah. They're in the same home, the dog's there every day, the dust is there every day. Allergy is itchy nose. sneezing. What comes out of the nose is often clear, and the child may have other allergy issues like cow's milk allergy or eczema. But if it's very infrequent, no other allergy issues, then probably not. But I see often doctors tell parents it may be his allergy. And of course, if you go on Google allergy, you then read about allergy epidemic, peanut allergy, children die.
Yeah.
So it's a disaster. But we have tests that we can check for allergies. So if it's a worry, then no harm in having a test. And then we can put your mind at rest.
Yeah. I mean, with our little boy, you could hear it is right behind his nose all the time. He'd go,
Yeah, absolutely. But if
That's
it's running
it.
around drinking,
I mean, this is the bed, the blob.
you know, but if the child is still, but then use the saline.
Yeah,
You know,
exactly.
You can use it as often as you like.
Yeah.
You know,
Yeah,
it's really about how often you want to use it. If you give a nebulizer, you give the spray, and the child hates it, fights it, and you find there's no benefit, then don't bother.
Yeah.
Because the child will cough and protect themselves. There will be a small number that get pneumonia, and then you look out for that deterioration, you come back. But it's not there's anything you've done wrong that's caused it. It's been unlucky.
Yeah, agreed. Let's talk about croup first. So signs of croup. What is the change between a cough and then a croup cough?
So the croup cough, so it comes on very suddenly.
Yeah.
Classically, if they've been asleep when they wake up, it's quite a barking cough.
Yeah.
And what causes it is some swelling around the throat, back of the mouth area, and they may have a bit of noise to their breathing. In the more severe type, they're struggling with their breathing. Often when children have it, they're prone to it, parents recognize it, etc. The treatment, it would be maybe a steroid nebulizer or steroid medicine, but I think coughing in a child that's running around playing is reassuring, but if there's any impact on the breathing or lethargy, again, or you know that your child's had croup before and it was quite serious, just get to hospital.
Yeah.
You know, ED, of course, you know, you don't need an appointment for ED in any hospital. They will assess, they will check you over.
So
And normally the croupy cough lasts a few days.
Yes.
And then you're left with just the normal cough.
yeah. Let's say, as you mentioned there, they develop croup. The cough turns from a normal cough to a croupy cough in the middle of the night.
Yeah.
Should we ever be concerned about them getting in trouble in their sleep with a croupy cough, or do they normally wake up and they're
Should
fine?
wake up,
Okay.
yeah. If they're struggling, they should wake up.
Okay, that's fine.
Yeah.
This is good to know. Because this anxious parent always
Yeah, exactly, but I think, you know, parents will then sleep with them if you know. So I think if the child has noisy breathing and they're asleep, if they're struggling, then wake them up.
Yeah, in their chest. You can
Yes,
see it.
absolutely, yeah.
I remember someone once said to me, it was actually when my little girl had RSV, and we were in here at the time, so we went to A&E in England, and they said if they're breathing and they're sucking in so much that you can see their ribs, this is a problem. If they're breathing, you're looking at their chest and their chest looks quite normal, and they sound a little bit wheezy, go get help, but it's not disastrous.
No, yeah. I mean, I think, you know, we talk about that and we give parents some information. I mean, we don't want, you know, parents have been the pressure to be close
Yes.
to the door. You know, if the child is struggling with their breathing, they're going to be lethargic, tired. They're going to be different to what, you know, you're going to see a clear difference in them, you know. But, you know, parents aren't doctors, and it still boils down to if you're worried, you get checked out.
RSV does the rounds. Love that there's a vaccine now for RSV.
Yeah, it's not widely available, but
No.
it's coming yet. I think
Yeah.
some places made it. Yeah, absolutely. It's
Mediclinic
great.
is one of them,
Yeah.
which is fantastic. And that was massively reassuring for me. I'm obviously not everyone in this world is vaccine pro. I love the vaccine, right or wrongly. I don't care. I love it. I like hospitals. I feel massive security in hospitals and vaccines, so I'm all for it. Because as I mentioned, my daughter had RSV at a young age, and RSV runs a course. If you're coming into the RSV, it peaks around 4 or 5 days.
Yes, so it starts off with a mild cough and cold, then it normally gets worse by about 4 or 5 days. So if you're a week in, then it's unlikely they're going to get worse. Problem with RSV, there's no treatment.
No, exactly. So what's the best course of action?
So it's just supportive treatment. So again, if a child's got a cough and a cold, monitoring their drinking, their breathing, their activity, if they're lethargic, I'm very boring. I say the same 3 things. And in fact, when parents come and they ask me, then they say, I know you're going to say breathing, drinking, activity, but these are the things.
Yes.
So if your child is becoming breathless, lethargic, and the fluid intake is going down or looking pale, get checked out, and you may need to be admitted if you need oxygen, if you're not drinking, if they're breathless, and you may need, but nebulizers don't help so much because it's not asthma, it's different, it's fluid, it's mucus in the lungs that needs time to shift through coughing, and the cough can persist a few weeks. But if they're drinking, and then at least you can spend most of that time hopefully at home. Children who are born early, preterm, or it's happening very young age, they are a bit more at risk, absolutely. So when you've got 3 or 4 children at home and you've got a baby, they're prime candidates to get it because one of the older children brings it back from nursery and school and they get it. Parents say, what can we do to sort of isolate?
You can't, it's impossible. Okay, and then antibiotics. Obviously, we know that RSV, these kind of things, you can't treat them with any form of antibiotics, but some coughs can, bronchitis, for example. That's an antibiotic one, right?
Well, bronchitis is just inflammation in the lung.
Is it?
Yeah, I mean, that's not... And I hear it around a lot. I think it's more...
Okay. When can we treat coughs with antibiotics ever?
Well, I mean, it depends what's causing the cough.
Okay.
So if we feel that there's a bacterial infection, then antibiotics can... But most coughs, particularly a sudden cough, bit of fever in a child is otherwise what... So pneumonia needs antibiotics.
Okay.
But that's breathlessness and lethargy and things like that and high fever. So if it's just a cough and the child is otherwise fine, I would perhaps give it a week or 2. Sometimes we may give antibiotics if it's lasted too long, but that's more than a month really. Or if the fever's persisting, or if we do a swab and we find some bacteria. But certainly most coughs, I would say, don't need it, And I guess, I think a lot of what I talk about to my parents is try to empower them really to try and say, look, actually, if your child's all right, don't even see a doctor.
Yeah.
Because if you see a doctor, you'll get antibiotics potentially.
Exactly.
And you won't know what, and then, so...
And sometimes they can do more harm than good. I mean, our kids shouldn't be getting antibiotics.
Well, I think too many courses. Yeah, absolutely. I mean, I think they don't... I mean, if you need them, then they do a lot more good than harm. And parents worry that antibiotics may weaken the immune system. Not at all. They support the immune system. And if you do give it in somebody who's got a virus, it's not going to probably do any harm. But it may make them a bit diarrhea, a bit weak, a bit sort of weak. But if you do lots and lots of them... then you risk of maybe developing some sort of, not intolerance, but some, whereby that antibiotic becomes less effective in the future.
Yeah.
It's affecting your microbiome. This is an area that we're learning has so many impacts on so many things. So, a lot of things we see is antibiotic allergy. Yeah. So lots of children are given an antibiotic. I say a lot, but a good number, and then they get a rash after a few days, and the doctor may think it's the antibiotic, but in the vast majority, that rash is caused by the virus that's making them go on the antibiotic.
Interesting.
But doctors may then say, okay, you've got penicillin allergy, avoid it, but that has consequences.
Yeah.
And I see children where parents are scared to give penicillin to their child because the mother has penicillin allergy, but actually the mother may not have penicillin. She may do, but there's a good chance she doesn't get her checked out, but we don't want to limit it in children. Penicillin is still a very good antibiotic.
Yeah.
So, I mean, on those sort of children, what we might do is give them a dose in the clinic and watch them for 1 hour, and almost always they're fine. Penicillin allergy, it does exist, but it's far less common than we think.
Okay, good to know. Supporting immunity. Now, this is a hard one, but obviously we don't want to throw the kitchen sink at the issue, but what are just general things that we can do to support our little one's immunity? Because obviously, to a certain extent, we want them to get these things. We want them to build their immunity naturally.
Yeah, no, I mean, I think, you see, a lot of parents think their child doesn't have an effective immune system because they're getting infections, etc. But actually they do. It's just normal to get some infections. Some children are a bit more prone, especially, some children maybe take a bit longer to get better than others. But as long as they get better, they're not coming into hospital, they're still growing, eating, not maybe when they're well, active, then the immune system is probably fine, the vast majority. So first thing, most children have normal immune system. Yeah. Okay, so there's nothing you can do, really. However, I think, healthy lifestyle, good diet, sleep, vitamins are important, and if you can get them in your food and their levels are fine, then fine. If you're worried that your child's vitamin levels are a bit low, they ask me a lot, what do you think? I don't know unless we do a blood test. But we don't want to do a blood test in everyone. So if you're worried, just take a supplement. But taking extra supplements in somebody whose levels are normal will have no impact on your immune system. Vaccines help the immune system, because they teach the body to not get that infection. So vaccines are important. Getting infections helps the immune system. You don't get it again. But the reality in the first few years of life, when they're exposed to all those infections, they need to get that immunity going with so many that they get so many in the early life, and then they get better. But these supplements, all these things you can try, there's so many, but I don't think there's anything that's been proven to necessarily work, really.
What about vitamin D?
Well, absolutely. You need vitamin D for your immune system to work. But if you already have good vitamin D levels, then giving extra won't have any impact.
Okay.
But if you're worried about your vitamin D, you want to play safe, give a supplement. Absolutely. And which one you give? Parents ask me all the time, what do you recommend? They're all the same. The best one is the one that your child will take.
Yeah.
So pick a one that's the right flavour.
Yeah, I love that. Okay, great. And just before we start to wrap up today, if you were to leave us with 1 to 2 bits of advice, what would they be?
So I guess I think, take the child as a whole. When you're trying to work out how your child is, what's best to do, it's not just one thing, it's the whole picture. We've talked about fever, when to be worried, when to cough. Coughing, fever we treat too often normal things that are helping the body. And then when we treat them and they don't improve, then we are more worried. But they won't improve. But it's looking at everything else rather than just those things. And I think feel more confident. Absolutely. If you're worried, don't think, oh, but Dr. Davis said don't go back. I'm not saying that. I don't know your child at that moment in time. If you're worried, see someone. But I think hopefully build the confidence to learn your child and see. And when things are mild and you can cope, you don't always need to see a doctor. In the UK, you're not going to see a doctor.
You're never going to see a doctor.
Now here, sometimes it's a bit hard. Doctors, are not always available, etc. But you can see them much easier. But then you end up seeing the different one. You get mixed advice. I see lots of parents who are given antibiotics and then they don't take them, which I'm not saying is wrong, but maybe don't see them in the first place.
Yeah.
So I think feel confident in power. You know if your child is sick. In the vast majority of cases, trust your instincts. I think that's one thing. Second thing, allergy. I have lots of bugbears about allergy, but I think, if a doctor, don't assume that you are allergic to anything that you've not eaten. There's no test.
No.
There's no test that tells you you're allergic. I need to put that out there.
Yeah.
A positive test only tells you might be. If you are allergic to something, it means when I eat it or breathe it in, there's a problem. So no one can say to you, you're allergic to peanut if you've never eaten it. You might be allergic to peanut. And if the test is positive, you might be. But it doesn't mean you are. So if doctors are doing tests on foods that you've not eaten, they should also be doing challenges to confirm that test. And most doctors are not doing it. And if you avoid a food which you've never eaten that has a positive test and you avoid it for a long time, you then may become allergic.
Yeah.
And that doctor may actually cause allergy.
Yeah.
So really important to understand about allergy, see somebody about that, but empowering parents. But when you're worried, trust your instincts.
Yeah.
No one's going to say that's wrong.
No, agreed. And for anyone who wants to come and find you, where can they find you, Dr. David?
Well, right now I'm out in Hants, but I'm not here. I'm not having any treatment. So I work.
We should, by the way, we should pop in. No, you look fabulous. Me, on the other hand, haggard by Parenthood.
So fabulous. I'm like, oh, it's been recorded. So I work at Mediclinic Parkview. I'm there full time. So you can book through the OK Doc or through the call centre. My parents have my contact details. I tell them I'm always available for walk-in, etc. But yeah, and if you want to see me for allergy or general peds, just book a normal appointment and hopefully we can help. And if I can't help, very much can signpost to the right people. Absolutely.
Thank you, Dr. David. You've been fabulous.
Thank you very much.